Afternoon, everyone. Today we are going to look into what are the basic principles of CT scan. In this lecture, I would like you to the basic objectives which we need to achieve at the end of the class would be: what is a CT scan, procedure of performing a CT scan, how is a CT image produced, and what does the different shades of gray in a CT mean to us. Before starting, I had sent you a pre-read up material and I hope all of you would have read that, and I'm expecting you to submit the responses to the quiz which we have produced in order to understand, in order to know how much we have understood and whether we should need to read the material back. And the reference is also given. I hope the book is accessible to all of you. So we'll now go to what is a CT scan. I want you to watch this video.
A CT scan is an X-ray procedure that creates cross-sectional images with the help of computer processing. CT images are more detailed than conventional X-ray images and can reveal bones as well as soft tissue and organs. A conventional X-ray uses a fixed tube that sends X-rays in only one direction, while a CT scanner uses a motorized X-ray source that shoots narrow beams of X-rays as it rotates around the patient. There are special digital X-ray detectors located directly opposite the X-ray source. As the X-ray passes through the patient, they are picked up by the detectors and transmitted to a computer. Image slices can either be displayed individually in two-dimensional form or stacked together to generate a three-dimensional image that can reveal abnormal structures or help the physician plan and monitor treatments.
Now please watch the next video.
Noah! Larry, what the hell are you doing?
Larry!
Larry, you can't just... Oh,
Larry! Oh, are you all right?
A CT scan, also known as a CAT scan or computerized axial tomography, is a painless diagnostic test that uses X-rays and computers to create cross-sectional images of bones and tissues inside your body. Your doctor may recommend a CT scan to examine your body for any of the following: blood clots, broken bones, cancerous tumors, infections, internal injuries and bleeding, and signs of heart and vascular disease. A CT scan helps your doctor select the correct location for surgery, biopsy, or radiation therapy, check the treatment of cancer or heart disease, and check your condition after surgery. A CT scanner is a large square or round X-ray machine with a tunnel through the center. During your CT scan, you will lie on a table that slowly passes through the tunnel. As you move through the tunnel, a giant ring called a gantry will rotate around your body. The gantry contains a tube that will release X-ray beams and detectors that will measure the amount of radiation absorbed by your body. The X-ray beams will capture many views of your body from different angles as the gantry spins. The detectors will send data to a computer that will create cross-sectional images of the bones and soft tissues inside your body. The scan allows your doctor to see the location of a condition inside your body, which will help them decide how to treat it or to see how well your treatment is progressing. In some cases, you may receive contrast dye before your procedure in a drink, an injection, or a barium enema to make it easier for your doctor to see certain areas of your body. If you received a drink with contrast dye, your esophagus or stomach will be highlighted. If you received an injection, your blood vessels, gallbladder, liver, or urinary tract will be highlighted. If you received a barium enema, your large intestine will be highlighted. After the procedure, you can resume your normal activities. If you received contrast dye, drink plenty of fluids to help your kidneys remove the dye from your body.
To cover in the class on CT, we'll first be looking into elements of the CT scanner, and then the process of making of a CT image, and then finally what do we view in a CT image and what does the contrast mean. First, let's look into the elements of a CT scanner. The components of a CT scanner include a gantry, which is the round which you see in the picture as a round shape. The next one is an X-ray source. It consists of a device called collimator. Then you have on the other side, when the X-ray source passes through the human body and goes to the other side, you have the detectors, and these detectors convey the information to data acquisition systems, and the operators can control the movement of the patient, as well as he can control the image features by having a separate panel. It's called as an operator control panel. First, gantry. It's a circular scanner into which the patient slides. It consists of a X-ray tube, a high voltage generator, a collimator assembly, a detector array on the other side, and the data acquisition systems. Now let's watch the video of what's there, how all these are arranged inside the gantry. Now let's go into each of the parts separately and look into what are the details about it, what does it contain, and what's the purpose of it, and how does it help in the protection of the final film. First is the X-ray source. As you all know, X-ray is electromagnetic radiation. We require a high voltage generator in order to produce X-rays, and these X-rays are produced at a very high intensity in a CT scan. The next is a collimator. When the X-rays are emitted, they all scatter in different directions. Now, if they are going to scatter in different directions, then the image cannot be captured. So we need to send it through a collimator. A collimator primarily converts all these rays which are moving in different directions to pass in a parallel direction. So how does this occur? you have different types of collimators, and the resultant beams can be passed in multiple directions depending on which structure we need to see. But basically, you saw how does it convert these rays into uniform parallel rays. This is the process of collimation. Next, once the rays are sent, they move across the body